Hi, I'm Bianca Castro with NBC5 Health Connection, a series of reports dedicated to keeping you and your family at your healthiest. We'd like to share with you some of our recent stories that feature your Medical City healthcare doctors, staff, and patients. You know, in Texas, it doesn't matter what month it is. Weather can be unpredictable, and storm fear can be debilitating, as we learned from some North Texans and the psychiatric experts at Medical City Green Oaks Hospital.
They're going to know what to do. Yeah, they're not going to be oblivious. So.
It's the first time Cassie McQuarrie and Tiffany Beatty meet in person. But a fear for what all of us see as part of life in North Texas brought them together 2 years ago online.
We met in the comment section in 2015, I guess?
Yeah, 2015 when it was a really bad spring season.
And that's when they connected.
Severe wind and hail.
Yeah.
After living for years,
Because you can see the rotation if you really watch.
Yeah.
thinking they were the only ones dealing with an inexplicable fear of severe weather.
Storm anxiety, you can't discuss it. Like, people look at you crazy if you're scared of rain.
I mean, I've witnessed it. I really have.
I have too. I've been called crazy numerous times.
I've been called Storm Girl, you know.
But names aside, these two deal with real phobias. Lilapsophobia is an abnormal fear of tornadoes. It's a type of astrophobia, which is fear of thunderstorms.
Somebody that has a phobia, that's something that is really diagnosable. That's something that is intense enough and persistent enough to interfere with the way that that person functions in their life.
And it doesn't take much to trigger the panic.
That is a portion of that thunderstorm that does have some spin and some rotation associated with it.
Rotation.
Make sure that you're taking your tornado precautions. That might have been the tornado.
I think that may have been the tornado.
Your brain is just scattered.
But Cassie and Tiffany have found the closest thing to a cure.
It's your storm room.
A weather tracking room where she watches what's happening on the radar across the United States and then informs everyone in a storm anxiety support group the duo started on Facebook. It's almost 800 members strong. They've armed themselves and hundreds of others with knowledge and have fared well since. But with each spring storm season comes fresh concerns. And if it makes you uneasy,
Come on over to DFW Storm where it's normal to be
it
anxious.
really is. And we'll be there for you.
Dr. Andrea Smith at Medical City Green Oaks recommends that if your storm anxiety is affecting your normal day-to-day function, it's a good idea to talk with your doctor about it. Well, the recent death of a South Carolina teenager from a caffeine overdose raises a lot of questions. How much caffeine is too much, and who's at risk for a serious health problem? We asked the experts at Medical City Fort Worth.
grief now pours over 16-year-old Davis Allen Kripe. Davis collapsed while at school in South Carolina last month and died. The coroner calls his death a caffeine-induced cardiac event. The coroner reports Davis drank a large caffeinated soda, a latte, and an energy drink in the 2 hours before his death. That's well above what's suggested as a safe amount for adolescents, which is 100 milligrams a day.
They typically say no more than 100 milligrams in a day. So just to give an example, I think if you get a large or jumbo-sized Coke from McDonald's or Burger King, has about 98 milligrams of caffeine.
In Medical City Fort Worth, Dr. Ashish Parikh says adults should consume no more than 400 milligrams of caffeine a day. That's about 4 cups of coffee or 8 cans of cola. Too much caffeine, especially in a short period of time, can lead to rapid heartbeat, stroke, heart attack, even death in anybody, regardless of their health.
Definitely, I think every parent should have that conversation with their kids, or what they keep in their own house and what they let their kids have at home.
A North Dallas 11-year-old is headed on a Make-A-Wish vacation of a lifetime, but the announcement itself at Medical City Children's Hospital may be as memorable as the wish itself.
They practiced
We have about 15 minutes till she gets here.
and practiced for a surprise these nurses rarely get to be involved in.
Alex is just a fun-loving, sweet little girl. She has a great personality.
And 11-year-old Alex is beating cancer. And today, Medical City nurses got to reveal that Alex is getting her wish.
My one true wish was to go to Bora Bora and stay on an overwater bungalow. And I just saw that a lot of YouTubers do that and go there. I've been wanting to go there for a long time, so that's what I picked.
The surprise equally as special for these nurses.
A lot of our job is really hard, and so if we can share in these happy moments that bring joy to the kids and the families that we take care of, it makes it all worthwhile.
Especially for one nurse in particular, Alex's mother, Brandy.
I know it's almost as special to them, probably, just to see the end result, and we don't always get to see the end result and happy results.
The end result today, a show of love for a lucky girl.
We love you, Alex!
She was so strong and good attitude. She definitely made it easier on us as parents. We didn't have to worry so much about how she was taking things and handling things because she's strong.
The flash mob surprise was part of National Nurses Week. We hope you enjoy the Medical City Healthcare headlines, and thank you for watching NBC5 Health Connection weekdays at 5 p.m.
NBC5 Health Connection is brought to you by Medical City Healthcare.